Okay, how's everybody doing? What an amazing weekend, huh? I want to acknowledge Jill Cisco as we kind of come to a close. I also want to honor our pharmaceutical companies who have so amazingly supported this organization. So if they're in the room, thank you very much. All the amazing speakers and all of you that are with us this weekend. I just want to give, because in regards to time, and I'll share who I am, but because we're going to be moving right into our breakout groups, which will begin at 10:30, I just want to let people know that the women's group will be in the Sontag building, which is again where we've been eating. The men will be in this room. And for supportive care partners, you'll be in the Eller room, which is across the way. So, well, let's get started. I'm going to be speaking for about 20 minutes or so. For those of you that don't know me, my name is Catherine Jonas. I'm a certified case manager and a licensed marriage and family psychotherapist. I consult with primarily Cedars-Sinai Medical Center in Los Angeles. Also work with Providence Health, also in Los Angeles, and do some work with UCLA as well. So I think it was about 15 years ago, someone came up to me when I was working at Cedars-Sinai Medical Center. It was actually Dr. Shlomo Melmid, for those of you that may know him. And he was running his pituitary program, and I was running groups at the psychiatric center, and he asked me to start running the pituitary support group to work on issues around emotional support and mental health services. And he mentioned a word called acromegaly. And guess what I had to do? I had to Google it. Was there Google back then? I had to look it up. And then I had to learn how to pronounce it. And I'll speak a little bit more to that as to why that was important to me at the time, because a lot of people come up to me and ask about how can I find a therapist who knows what acromegaly is? And chances are you may not find someone who knows what acromegaly is, and you may have to give them a little information about it. Like I had to become knowledgeable and kind of become an expert in working with patients with acromegaly. I have a PowerPoint presentation that I may move in and out of, just in the interest of time. But I did a little Google search standing in the back about emotional support. And this is what Google says. Effective emotional support is respectful, treating the person in need with dignity, consideration, non-judgmental, which means that a person does not feel judged when you're feeling your thoughts, when you're sharing your thoughts, your feelings, your perspective. You're being compassionate, empathetic, not sympathy. We're not feeling sorry for someone. We're being empathetic. We're trying to go into their shoes, providing reassurance and understanding. Would most people think that that's what emotional support is? Right? Supporting around somebody's emotions. So let me see a show of hands. How many here are patients? Raise your hand. Okay, I would think the vast majority of you. How many of you are supportive partners? Wonderful. And thank you for being here. You're amazing for being here. And we are going to have that support group also for supportive partners, because you as well, being a partner with a loved one with acromegaly, you have a story as well and a narrative as well, and need your own support. So I kind of want to delve into this a little bit as to why kind of emotional support, mental support, having people in your life that are supportive to who you are is important. And primarily is that And this presentation is really based on who you are as a person with acromegaly. So we've heard a vast majority of speakers this weekend speak about their expertise, identifying the chief complaints and providing solutions. This portion of the conference is really about what can you do as the patient? How can you advocate for yourself? So when I work with patients, when they first come to me, part of the identity that I notice with them is that it's shifted. They're presented with new information, and part of me is deconstructing that and reassuring them that you are not just your diagnosis. Upon original meeting of the doctors, finding out what's going on, you may feel this way because your personal identity is really disruptive. My presentation is really focused on how well you cope and what are those psychosocial stressors for each of you. So I want to identify some of the psychosocial stressors, psychological challenges, social, occupational, how you're coping. So as I mentioned, when we first confront a diagnosis, and for many of you, it could be years before there is a diagnosis, right? Where you've been told, oh, you're just depressed, or don't worry about your headaches, they'll go away. Well, what happens when you first have a diagnosis? Perhaps you feel relieved that there's something, but then you need to look at how is this affecting my interpersonal relationships? How do I incorporate this new information? Who am I now? What is my life going to look like now? We spoke about this weekend about surgery, maintenance, and what about medication compliance? When you're faced with acromegaly, you're also faced with lifestyle changes. Would you agree? Major lifestyle changes. You're dealing with medication compliance. You're dealing with side effects, breakthrough symptoms. How do I balance all this in my life? How do I handle this in my marriage with my children? What's my attitude about it all? How am I relating with others? Am I attending events or am I putting things off? Am I isolating? Am I turning things down? Let's talk a little bit about coping. The definition of coping is our specific efforts. So I'm not talking about medication. This presentation is not about medication or treatment modalities. I'm going to go into a little bit about cognitive behavioral work. I heard a lot of presenters this weekend talk about cognitive behavioral. I want to explain what that means. Coping is how we get through the day. Specific efforts, behavioral, psychological, which people use to master, tolerate, reduce, minimize stressful events, how we cope. So I've come up with 5 main types of coping mechanisms. You can use each of these within a particular situation. And the goal here, again, which is different from the other speakers, is to identify where do you go when you have a stressful event? How do you cope with it? Are you a fighting spirit? So that's a definition I've come with. You see the illness as a challenge. You have a rational attitude towards the outcome. You have an active role in your recovery. And you can exert some control over stress. I have acromegaly, it doesn't have me. Do you avoid things when you raise your hand? Anybody avoid or go into denial? Okay, I see a few hands. I bet there's more of you out there. This is common. This is normal. This is a safe place where a lot of us go when we're faced with a stressor. We deny the impact. This can lead to unhealthy behaviors when we live in denial. Denial may be okay in the beginning, but for a very short time. And we want to really make sure that we become aware of denial because it can lead into those mood disorders, which we want to be aware of, like depression and anxiety. Does anyone go into fatalism? Anybody know what that is? There's no control, kind of passive acceptance. I don't care, doesn't matter. It's all in the hands of fate, and I don't need to do anything about my condition. It's a very common coping mechanism. Sometimes people go to helplessness or hopelessness. It's very common for most people to wiggle and wane in between these different coping mechanisms. People will say to me, well, how can helplessness or hopelessness be a coping mechanism? But anyone ever feel helpless or hopeless? Okay, I'd like to see the hands. Thank you. Okay. Now, I don't want you to live in that, but I want you to kind of, if you're in that, to be cognizant of it, to be aware of how you're feeling. We want to be mindful that you don't stay in this for very long. And if it's periods of time where you're not seeing hope or feeling like you have help, that's where you want to get some more supportive services and check in with the emotional support in your life. Anybody get anxious? Anybody go to anxious preoccupation? I feel this, or I have this new pain, or I'm worried about this. And so we go on the internet and we search and search and search, compulsive searching. We spend time here in worrying, okay? Very common. It's a coping mechanism. Be mindful of this. I can't cope with not knowing what the future holds. Very common. So we all know about stress, right? There's a variety of different stressors in life. Life is full of stress. There's positive stress, there's negative stress, there's controllable stress and uncontrollable stress. Who should I use as a healthcare provider? Which procedures should I undergo? If there aren't people in my hometown that can support me, where can I get help to find someone that's going to listen to my problems? Uncontrollable is that there's a pituitary condition called acromegaly that you have, and the fact that you need treatment. So coping with controllable stressors. These are strategies that I want you to think about as you're listening to me speak. How do you problem solve decisions that you make? Seeking goals or seeking information, setting goals. Feeling like you're in control of the decisions that you make. I want you to be an active participant and player in your recovery. Asking those questions that you've been doing this weekend have been very much an example of being an active participant in your own recovery. Okay, so what about uncontrollable stressors? What about things we can't control? The headache that just won't go away, the medication that someone's recommending that's not working. So I want you to start becoming aware of your emotional reaction, challenging thoughts, feelings, and behaviors. And that's the premise for cognitive behavioral work, which is the responsibility of the patient. We can also engage in relaxing activities, breathing techniques, mindfulness exercises. So how are you managing symptoms when we talk about breakthrough symptoms? Despite receiving treatment, how do you deal with hormones being all over the place, where levels are in normal range or sometimes they're not? How do you deal with fatigue, body aches, joint pain, sweating, headaches? So you have the modalities of the treatment that the physicians are giving you, but what are some other techniques that you as the patient can do? Are there things that you can do? Again, some examples of acro rage. Anybody heard of acro rage, acro fog? We haven't spoken that much about it, but it is real. And when we go back to kind of emotional support, for those of you that have partners in your life, this is real. It's very important. And it's something also to just be mindful of as yourself to try to regulate, but it is a hormonal aspect to this. So let's talk a little bit about cognitive behavioral theory. The idea, so cognitive is how we think, right? It's brain, how we think. Behavioral is the actions that we take, okay? The theory is that there's always a thought, right, that comes first, and then there's a feeling, and then there's an action, okay? So it's a relationship between the way we think, our emotions, and how we behave. Situation, thought, emotion, behavior. The theory being that a situation doesn't have to change, but our thoughts, emotions, and actions can. So think of anything in your life that's, constant. And again, I'll just repeat this. A situation does not need to change to change the way we feel about it. The way a person thinks about a situation will ultimately affect how you feel, and then ultimately the actions you take. Action meaning showing up at the wedding that you've been putting off because you don't want people to see maybe how you look, or not showing up at the work event. The theory also states that we have automatic thoughts which affect our emotions and actions. These are the thoughts that just come right away. They travel so quickly, they're instant, and they usually precede every feeling and action we take. So let's talk about an automatic thought. Doctor office calls. The immediate thought is, I know it's bad news. The emotion after having that thought is fear, sadness, anger, and maybe the behavior is not getting out of bed. Can anybody relate to this? All right. So I see a couple hands. So that's the situation. So we want to kind of stop those automatic thoughts. And for all of you in this room, or most of you, this may be a new way of thinking, to be mindful of what are the thoughts that just come in your head automatically. Feelings are not facts. You've probably all heard that before. And what we're looking at is we want to look at rational thinking versus irrational thinking. I'm not crazy about think positive, like everything's perfect, because it's not, Life is hard. Life has stressors. You didn't ask to have acromegaly, So you're dealing with all of these life-changing aspects and physical aspects and psychological aspects, and your partners are as well. So how can we tell a difference between the way we think? Okay, rational versus irrational. So the theory talks about asking yourself 3 questions. So we're going to kind of do some challenging of facts here. Are my thoughts based on fact? Are they real? I'm just talking about our thinking, okay? So let's give this example again. The doctor's office has called you. You haven't talked to the doctor yet. You haven't returned his or her call. You don't know. And is that right? You following me? You don't know why they're calling. They could be calling because they're updating their database and they want to confirm your address, right? They want to double check your insurance, or the nurse is calling for some reason. The idea is, does my thinking help the way I want to feel, right? Does it help me want to achieve my goals? Maybe my goal, and I'm not talking about huge goals, I'm talking about getting out of bed. Simple, simple, simple. If you answer no to any of these, the idea is to maybe change your thought. Not easy to do because it is a theory, but it's something to think about as far as how you contribute in yourself to how you handle your life with acromegaly, or maybe you're a supportive partner without acromegaly. And then you can ask yourself, do I want to keep the thought or do I want to change it? So the doctor's office has called you. Irrational thought is, I know it's bad news. That is completely that is irrational thinking. How do you know it's bad news? Right? You don't, right? So ask yourself 3 questions. Is it a fact? No. Okay. Is it making me feel any better? No. And is it helping me get out of bed? So how about this? I don't know the news and I will be able to handle whatever lies ahead, and I can always call Jill Cisco. How about that for a rational thought? I don't know what the news is and I'll be able to handle whatever lies ahead. Okay. How does that make you feel if you think that way? Right? Or I can go on the Acromegaly community Facebook page and I can reach out to someone that I met here. Making a new thought grow takes practice. I struggle at it, but I've become more and more aware of when I'm having an irrational thought. I can't do this, or I can't do that, or this or that. Just notice the thinking, being repetitive. Some core beliefs that we talk about, these are unconscious. They impact our interpersonal relationships. I'm going to move through these slides a little bit more. According to cognitive behavioral therapy, these are commonly irrational core beliefs. Some of you may be able to relate to these. So we want to manage stress. Everybody has stress. All right. Everybody has stress. It's normal. And no one can tell you or should tell you that your stress doesn't mean anything. Stress is stress, right? And so it's really about how you choose to cope with it and what are your thinking ideas around the stress. Are there losses in your life that are dealing with stress? Are you creating unneeded stress? Do you have people in your life that are not supportive to you, that don't understand you? Are you taking care of yourself? What's that look like? Taking care of yourself. We heard a lot about sleep hygiene. I'm a big believer in getting excellent sleep and really focusing on that. Are you eating well? Are you resting? How are your interpersonal relationships? Are you playing a little bit? Is there anything fun going on in your life? Are you reaching out to others and seeing how they're doing? I know we've got a couple minutes, but I want to go through these slides because I think these are really important. A lot of times when I work with my patients with acromegaly, we talk about grief and loss. And we talk about the sadness around having this and having to cope with this. And so coping with loss is a deeply personal and singular experience. Everybody is going to have their different relationship with grief and loss. The best thing you can do is allow yourself. Grief and loss, there's no timetable, right? And I think it moves in and out of one's being, and to be very patient with yourself. Try not to resist it. Try to talk about it with other people. Denial, we talked about that earlier as a coping mechanism, but it's very common with facing a major stressor to have denial. Pretty normal, but we want to make sure that it's temporary. Anybody angry? Anybody feel angry at times? Okay, it's important to talk about those feelings, right? It's really important to talk about those emotions with people that can relate to you. Why me? Life is not fair. Anger needs to be expressed in healthy ways. Bargaining. This is a normal reaction to feeling hopeless and vulnerable. If only statements. Oftentimes there's guilt in beating yourself up. Anybody ever feel depressed at times? Yeah. And so I know there's a lot of talk about what's causing the depression. Is it the acromegaly? Is it the changes in the hormones? Is it an adjustment disorder? I believe it's all of the above. And I think it's very common. I think most people actually have what's called like a dysthymic, kind of a low grade chronic depression. There are ways to work with depression. The most common treatment modality for depression is to work with psychiatry, working with medication, but it's really important that you work with, your endocrinologist or any other specialist you have about introducing an antidepressant. And there are ways to treat depression with talk therapy is very important as well, especially if the depression is acute, if it's really focusing on the real negative feelings about yourself, where you're not wanting to live anymore or hurt yourself, it's very important to get treatment around that. Grief and loss, at times we move towards acceptance. And it doesn't mean everything's perfect. It doesn't mean you're okay with having acromegaly and the treatment modalities and everything that you have to deal with, and doctors agreeing with you or disagreeing or gaslighting, but it's moving within a space within yourself that at least I can accept that this is my life, and I'm going to be that active player to work on what I can do to cope. So it's accepting the reality, seeing that you can, again, cope with whatever lies ahead. I really like utilizing bibliotherapy. Joyce Rupp has a wonderful, wonderful book, Your Sorrow is My Sorrow, for those that lean towards more of a Christian faith. It's a beautiful book sharing about different aspects of sorrow and hope and strength. I believe in this one book that I really like called The Jewish Book of Grief and Healing, which is really, really helpful. And then I've identified a book as well that is kind of Your Grief, Your Way. It's the more generic for those people that are dealing with grief and loss. Support groups. You're all here for Acromegaly community, and I'm so glad you're here. The purpose of support groups is really to connect with others in a safe environment, right? So you may find the benefits of a psychotherapist, but it's, I think, being within a group, because there's a common modality or a common ground, if you can, that you've all been where each other are. And so it's really important to share that with each other. You want to feel understood and encouraged to reach out to each other. This is a quotation I like. Again, focusing on cognitive behavioral therapy. Watch your thoughts. They become your words. Watch your words. They become your actions. And watch your actions. They become your habits. And watch, because they become your character. And your character ultimately becomes your legacy. So be mindful about how you think, how you focus on your emotions and your actions. I want to thank you for your time today.